This is me doing face yoga.
I want to show you a short face yoga routine if you have just 2 minutes.
I'm a board-certified eye surgeon specializing in oculofacial plastic surgery. I've spent 15 years operating on eyelids, and I am currently making this face in my office because the internet told me that it would fix droopy eyelids. I'm so sorry to be the one to disappoint you, but this is not going to fix droopy eyelids. And by the end of this video, you're going to understand exactly why, and why continuing to try might actually make all your wrinkles worse. Okay, so here's the first claim that the face yoga folks make. Exercise builds muscle. Okay, maybe so. Bigger muscles fill out the skin from underneath in the face? No. Therefore, your face looks lifted and fuller if you exercise. Doubt it. It works for your biceps, so why not your face? So on the surface, yeah, I guess this sounds reasonable. And to be fair, there is actually one small study, Northwestern University, 2018, took a bunch of middle-aged participants who did face exercises for 20 weeks, and by the end they said they had slightly fuller looking mid and lower faces. The face yoga community cites this constantly, and I want to be honest, it exists and it found a modest positive result. But here's the problem with that. It was a tiny study with no control group, meaning they didn't have a group of people that didn't do face yoga to compare it to. It did not rely on anything objective. It had one rater who looked at photos. Let me give you a pro tip here from an insider. With anything in science, if there's only one study showing a positive result, you should question it. Because in science, you need multiple studies done by different people in different places, all pointing to the same result before you believe anything. That's called replicating the results. If a study ain't replicated, it probably ain't right. So one study is very thin evidence on which to build an entire wellness industry. Here's the deeper problem anatomically. Facial aging is not primarily a muscle problem. Your face isn't drooping because your muscles got weak and needed a workout. It's drooping because of 3 things happening simultaneously: skin laxity from collagen loss, fat atrophy over time, and a small amount of resorption of the bone, where the actual skeleton of your face can shrink over time in certain spots. The muscles in your face are already among the most active and strongest muscles in your body. The masseter muscle that you chew with, pound for pound, that's the strongest muscle in your entire body. There was a trapeze artist back in the 20s that used to hang from a trapeze just by clenching his jaws on the trapeze, just to show you how strong the masseter muscle is. You make thousands of micro expressions every single day. Your facial muscles do not need more exercise. They need the supporting structures, think skin, fat, etc., around them to be restored. So the claim that facial exercises build muscle and lifts sagging skin, zero evidence to support that this is true. Okay, let's get to the second claim. The second claim they make is that exercise can fix a droopy eyelid. Okay, this is the one that concerns me the most because as an eyelid surgeon, this is the most medically specific claim and the most medically wrong. When people talk about droopy or hooded eyelids, they're usually describing one of 3 things. And you can see some of my other videos if you want to get more information about this. A droopy eyebrow or sagging skin or ptosis. Ptosis is where the muscle that lifts the eyelid is detached or stretched out. See my video on hooded eyelids for more info about these 3. Face yoga proponents suggest that exercising the muscles around the eye by raising the eyebrows, widening the eyes, and doing resistance exercises with your fingers can lift the lid and reduce the hooding. So let's take extra skin, also known as dermatochalasis, first. Excess eyelid skin is excess eyelid skin. It is a tissue problem. You cannot exercise away all the extra skin. Go ask your friend that's lost a lot of weight on Ozempic if exercise is helping all the loose skin around their belly. Actually, I'll save you the time. It isn't. And that's why there's an explosion of plastic surgery recontouring people's bodies by removing skin after massive weight loss. But that's a topic for another day. The extra skin on your eyelids is because collagen has broken down and the elasticity has been lost. The only way to address that is to remove the redundant skin, which is what an upper blepharoplasty does, through a small, well-hidden incision that hides in your natural eyelid crease. Now, ptosis, an eyelid that's low because the levator muscle is stretched out or detached, the claim here is that lifting the eyelids more open will exercise that muscle and just bring it right back up. But folks, I'm a surgeon. This is not how the levator works. Ptosis happens when the connection between the levator muscle and the eyelid platform, a structure on your upper eyelid and lower eyelid called the tarsal plate, when that connection stretches or separates, the eyelid droops. Let's just take another example. Let's just say you tore the tendon that connects your bicep to your forearm. It doesn't matter how strong your bicep is. If it has no physical connection to your forearm, you are not going to be able to lift your arm up. It's really just that simple. Eyelids are exactly the same. The fix for eyelid ptosis is surgically reattaching that tendon so that your eyes can naturally open when your brain tells them to open. Ptosis can sometimes be a sign of an underlying neurological issue. It should be assessed by a specialist. Telling people to just exercise it away, it doesn't just delay cosmetic treatment, it can delay the diagnosis of something more serious. If you're finding this video useful and you want more videos that cut through the noise on eye health and eyelid aging, hit the subscribe button. I try to make this the channel where you can get actual science, not the version that's trying to sell you some sort of course. If you're thinking about eyelid surgery and you want a consultation with us, go to eyelid.pro/book to schedule an appointment. Okay, now the last claim, and this one's a doozy. Facial exercise reduces wrinkles. This one is almost perfectly backwards to me. The face yoga argument is that moving the face strengthens underlying muscles, which plumps up the skin from beneath and smooths out lines. Here's what we actually know about how wrinkles form. They form precisely because of repeated muscle movement. So every time you squint, raise your eyebrows, furrow your brow, you are folding the skin in the same place every time. Over time, collagen breaks down at those fold lines and the crease becomes permanent. We call that a static line. This is literally the mechanism that Botox was designed to interrupt. By temporarily relaxing the muscles that make those lines, you stop that repetitive folding and you let the skin recover. So when face yoga tells you to repeatedly scrunch, widen, and move your face in exaggerated ways, it is from a wrinkle formation standpoint the exact opposite of what you want. You are not smoothing wrinkles, you're actually rehearsing them. There is no scenario in which more facial treatment is a wrinkle treatment. So let's talk about what actually works. I want to end this practically because the goal is not to leave you feeling like nothing helps. It's to point you toward things that actually do. For hooded eyes from excess skin, upper blepharoplasty or an eyelid lift is the gold standard. It's one of the most straightforward procedures in my practice. The incision sits in your natural crease of your eyelid, and it's essentially invisible once it's healed in most cases. For true ptosis, an eyelid that's actually too low, meaning where the eyelashes come out is too low, I reattach the muscle attachment so that the eyelid sits at the appropriate height. This is more involved than a standard blepharoplasty, and it requires a surgeon who really knows eyelid anatomy. For wrinkles, the Honest Toolkit includes skincare, possibly Botox from dynamic wrinkles. Dynamic wrinkles are the ones that form when you actively move your face. And Botox works by interrupting that repetitive folding. And then also energy-based treatments like laser resurfacing for texture and sometimes for skin laxity. None of these are face yoga. All of them have real clinical evidence behind them in multiple studies. For overall facial volume loss and the structural drooping that comes with it, that's the fat atrophy and the bone resorption thing we were talking about earlier, that's a whole video unto itself. But the short answer is that fat grafting or fat transfer to revolumize the face is going to help that the most. There is one time when exercising can actually help. Because I want to be fair, I'm not saying that touching your face or massaging your eyelids is always useless. The one situation where it's genuinely medically beneficial is after eyelid surgery, scar tissue can develop along the incision line as the area heals. There are some reasonably good studies that show that gently massaging these areas, I recommend like 15 to 30 seconds, especially along that outer bone area, smooths out your scar line and helps the incision flatten a little bit sooner. I don't recommend doing this until you're about 2 weeks after surgery because you don't want to do anything that's going to open up the wound. What this can do is it can smooth out small bumps and irregularities, and it encourages the incision to heal flatter and softer. This works, it's evidence-based, and it can make a difference in the quality of the final result. So eyelid massage, that is an excellent tool for post-surgical healing. It's not a treatment for drooping, wrinkles, or aging. That's the nuance that the face yoga world never gives you, not because touch is magic, but because context is everything in medicine. So I will say this till I'm blue in the face. No amount of making this face is going to fix your wrinkles or your face sagging. It could actually make it worse. If you're bothered by drooping, hooding, or eyelid heaviness, get a consultation with somebody who specializes in this area. Not because surgery is the only answer, sometimes it isn't, but because you deserve an accurate diagnosis before you spend months doing something that isn't built for the problem that you actually have. Your face will thank you. If you enjoyed this video, please consider subscribing to our channel for more tips on eyelid and facial surgery. Thanks for watching, and I'll see you in the next video.